And here we go. We left it here on the clinical features of Cushing's syndrome, which is a very devastating condition. And as we said, there are different plethora of different, because it regulates multiple organs, right? And so here we go. We left it here on the clinical features of Cushing's syndrome, which is a very devastating condition. And as we said, there are different. There is also this deposition of fat because it regulates multiple in the belly organs, but right? Also so it's very important to note that it can have psychological effects like euphoria and sometimes depression of psychotic symptoms. A picture of a patient. There is right? Also, so for example, deposition of fat in the Cushing's syndrome, in the belly, and but after the treatment of Cushing's syndrome. So you can see here the appearance and also like this very expanded I think that facial features we should give you with acne a picture and abnormal of a pigmentation. Right? So for example, this is at the back of the neck of Cushing's syndrome after the treatment of Cushing's back to normal features. So you can see here but the also we can see like this very let me show you here a typical facial features with acne Cushing's and abnormal pigmentation. Fat deposition at the back of the neck, fat deposition is after in the belly, treatment, and also there is this back to normal features, and also but also arms, we can see, and you can see. Let me show you here a typical case of Cushing's disease. Cushing's syndrome, this gentleman manifestation, and you can see very big fat deposition this type of in the belly, and but also there is this in the clinics, different and ones, also it also can affect. And you can children, see this but also adults, right? And remember, this can come from either a normal in the adrenal gland that produces too much cortisol in cortisol or patients, a pituitary tumor, but also from external causes of children that produces ACTH, right? And remember, this can come from either a tumor in the adrenal gland that produces too much cortisol. If we go back at the different possible scenarios, or a pituitary tumor, but also the hypothalamic pituitary adrenal of a tumor that produces ACTH ectopically. Okay? So if we go back at the different possible scenarios, right? We have, let's say, hypothalamic that the different adrenal clinical first scenarios that you may be finding is that first of all the patient needs to be assessed whether this patient was under steroid therapy. Why under steroid therapy? Let's say because the steroid therapy clinical will produce scenarios cortisol that you may level finding ectopically is that first of all the patient commonly needs to be assessed, for example, whether in asthma treatment under or for example certain drugs. Why for example hydrocortisone? Because steroid therapy will produce ectopic eczema, cortisol or dermatitis, ectopic psoriasis, and those so high levels of commonly used drugs, for example, will affect the hypothalamic or for example adrenal drugs, or for example hydrocortisone increase also the levels chemically of ectopic cortisol or dermatitis or psoriasis. So high levels of these ectopic drugs will affect the hypothalamic adrenal axis is under negative because feedback regulation from the adrenal gland. So the level cortisol will negatively influence the secretion at this level. Adrenocorticotrophin hormone from the pituitary gland. This, but also it will affect pituitary adrenal axis secretion is under negative feedback regulation hormone from the adrenal gland. So too much cortisol will negatively influence the secretion to exclude whether the patient hormone from the pituitary was diagnosed with Cushing's syndrome or Cushing-related syndrome due to ectopic corticotrophin releasing hormone from the hypothalamus or drugs that affect the hormonal be able to exclude whether the patient on the second was diagnosed with Cushing's primary syndrome or Cushing-related syndrome due to ectopic use of two different hormones of or drugs that affect the hormonal production of cortisol, and the other one is adrenal on the second scenario, what these adrenal tumors appear in the cortex, which is basically increased cortisol levels of cortisol, which will feedback negatively into the pituitary gland and adrenal negative into the hypothalamus, and the other one is produce less corticotrophin releasing. These adrenal tumors appear in the cortex into the pituitary gland and what will produce is excess levels of cortisol. This will feedback obviously negatively into the pituitary gland by the high production levels of cortisol to hyperplasia less of the adrenal releasing hormone, in this case into the pituitary gland to produce less a tumor in the zona fasciculata that this in turn excess obviously it's override by the high production the negative feedback cortisol, and we will come back to this because this is very of the adrenal zonation and the time in this case of diagnosing zona fasciculata and a tumor in the zona fasciculata that produces excess of so the cortisol. Other scenario is that we have this a secondary is the negative feedback situation, and we will come back to this. The hypothalamus is normal; it secretes the time corticotrophin releasing hormone, but there is a big pituitary adenoma, right, that produces too much ACTH. So the other scenario is that we have a secondary is that situation on where the hypothalamus is normal; it secretes corticotrophin releasing hormone, which at the same time big pituitary negatively feedback into the hypothalamus, right, that produces too much ACTH. But what happens if we produce too much ACTH? Because is that it impacts on right, and the production will produce of excess of ACTH in the adrenal gland, which at the same time so what about negatively feedback into the hypothalamus? In the ectopic Cushing syndrome, what we have obviously the pituitary override the hypothalamus produces right, and the tumor will produce excess of or corticotrophin releasing hormone, which will activate so what about ectopic Cushing syndrome ACTH? In the ectopic Cushing syndrome, what we have is because there is a tumor, for example, in the lung, a small lung carcinoma, CRH, which may produce ACTH releasing so hormone, neuroendocrine or endocrine tumors produces ACTH. But there is an excess too much hormone ectopically from the because there is a tumor, for example, in the lung, the adrenal gland carcinoma, which may produce ACTH, and it will so give also the same appearance of ectopic produces Cushing syndrome or Cushing syndrome. That's why it's called too much hormone. It's called ectopically from because it's not produced. This also will affect the adrenal gland, and will produce, but it comes from another organ where there is also the same appearance of ectopic. As we see before, syndrome, this is what happens. That's why it's called ectopic. It's called ectopic that because it's not produced in the Cushing's. Very adrenal access, but it comes from another organ where there is increase and obviously lethargic, increase as we see before, and there are lots of several comorbidities, and this is after treatment with the normal appearance. Cushing's. So just to remind from another lecture, and this is what is important, right? And obviously what are the actions of cortisol? Increase of obesity. So the main action of cortisol, if you remember from the lecture that we did, this is in the hypothalamic with the normal pituitary axis, is increase so in just plasma to remind glucose. From another lecture, it increases, it increases gluconeogenesis. What are the actions from the liver? Okay, so it produces the main action of cortisol, if you remember from the lecture that we did, it decreases glucose utilization by inhibiting in plasma the glucose for it increases gluconeogenesis from the liver, and it decreases so it produces glucagon and more glucose from it also affects decreases glucose fat utilization and increases lipolysis by inhibiting and provides the energy for transport. So those are the two main actions of cortisol, but also many other actions which are also very important, such as also protein affects the catabolized fat, and increases lipolysis
amino acids
and provides
from
energy.
the muscles.
So those are the two main
and it
actions
has
of
a very
cortisol,
important
but
role
also
in
many
the
other
kidneys
actions
for
which
the
are
sodium
also very
and water
important,
retention,
such as
very
protein
important in
are
electrolyte
balance and balance on
release
of
amino
the,
acids from the muscles. And it has a very important role in the kidneys for the sodium and water retention.
also increases
very
gastric
important
acid
in
production
electrolyte balance
and
also
balance
has important
the,
in immune system repressor.
blood.
So is immunosuppressant.
It has
a very
all
strong
these
anti-inflammatory.
remember we studied
in
the
the last
function,
lecture
cortisol,
on
but also
the
increases gastric acid production
hypothalamus
and
adrenal
also
axis
has
in the
important
normal
in
physiology
immune
of the
system
adrenal
repressor.
Okay,
But
so
this
is
is just a
immunosuppressant.
reminder.
So as you may
all
these
remember we
is
studied
that in the last
abnormalities
lecture
on
increase
the
of ACTH
hypothalamus
affects
adrenal
all
axis
these
in the normal
systems.
physiology of the adrenal.
Okay, but this is just a reminder.
So
as you may
what does cortisol do?
as we said,
Is
it
that
increases the blood amino acids
abnormalities
from the muscle,
in
blood
increase
glucose, it
of
increases blood
ACTH
lipids,
production,
it increases
affects
calcium,
all
it
these
suppresses
systems.
immune response,
Okay?
it increases red blood cells.
So
And it
what
is
does
an
cortisol do? As we
anti-inflammatory
said, it increases the
permeability
blood
and
amino
it
acids from the
increases
muscle,
appetite,
blood
glucose,
because it
increases
affects
blood
the
lipids,
hypothalamus,
it increases
functions
calcium,
on appetite.
it suppresses immune
Okay?
response, it increases red blood cells, and it is an
So the
anti-inflammatory
central clinical
permeability
features
and
of
it increases
that you will
appetite
find in
because it
patients,
affects
right?
the
So the clinical
hypothalamus
features are
functions
central
on
obesity,
obesity, okay, moon face, buffalo ham, thick skin and easy bruising,
So the
osteoporosis,
central clinical
and
features
mainly
of
diabetes
that you
because
will
it's
find
connected.
in patients.
Remember that you
right?
have
So the
more
clinical features
cortisol
are
in a
central
situation
obesity,
of stress, more glucose
moon
is produced
face, buffalo
in
ham,
the
thick skin
liver,
and easy
glucagon.
bruising.
It
Osteoporosis
also
and
stops
mainly
the reabsorption
diabetes
of
because
glucose
it's
or
connected.
utilization
Remember
of
that you
glucose
have
more
by interfering
cortisol
in a
with the
situation of
receptors,
stress,
more
right?
glucose
Very,
is
very
produced
important.
in
Okay?
the liver,
Just
glucagon. It also stops the reabsorption of glucose or utilization of glucose by interfering with the receptors. Right. If we look at the different changes, obviously the central
Just
obesity, moon
second.
face, buffalo ham, and all these ones are changes in protein and fat metabolism.
So,
Excess in hair growth, irregular periods, problem
if we
conceiving
look at the
impotence,
different changes,
are changes
obviously
in sex
the
hormones,
central
right?
obesity, moon face,
and
buffalo
high
ham,
blood
and all
pressure
these ones
and fluid
are
retention.
changes in
It's
protein
also
and
very
fat
important.
metabolism.
Okay, excess in
And
hair
those ones
growth,
are
irregular
high blood
periods,
pressure
problem
and
conceiving
fluid retention
impotence,
with
and
salt
changes
and water
in sex
retention,
hormones, which
right?
is the effect
And
of
high
corticoids
blood
in
pressure
the
and
kidney,
fluid retention,
which we have
it's
studied
also
before.
very important.
Okay, so and those ones are related high blood pressure and fluid retention.
This is
with
again
salt
one
and
of the
water
patients,
retention, which
right?
is the
And
effect
what we can
of
see
corticoids
is
in the kidney,
that
which we have studied
this
before.
patient
has Cushing's disease and syndrome. Remember all the facts that
So,
we have told before. Central obesity, you can see it here.
This
with
is,
strias
again,
in the belly,
one of the patients,
right?
right?
Buffalo ham,
And what we can
thick
see
skin, osteoporosis,
is
diabetes.
that
Remember
this patient
all this
has
for
Cushing's
the
disease and
diagnosis
syndrome.
of Remember
Cushing's
all
syndrome.
the facts that we have told
This is
before.
another
Central
patient.
obesity, you can see it here with the strias in the belly, right?
Is
Buffalo
a
ham,
Cushing's patient
thick skin,
with
osteoporosis, diabetes. Diagnosed.
Remember
you can see
all this
big
for the
incorporation
diagnosis
of fat,
of
increased
Cushing's syndrome.
Facial features.
This is another patient.
Ectopic hair growing, and abnormal pigmentation. Right?
So, what do we need
Is
to
a Cushing's
assess
patient
when we have
diagnosed? You can see big
Cushing's
incorporation
disease.
of fat, increase.
So
We need to look at the hypothalamic pituitary hair growing
axis
and abnormal
so we need to look at the
pigmentation.
levels of
So what do
cortisols
we
and
need to assess
ACTH
when
in the blood,
we have,
but also in the urine cortisol and also
Cushing's
in the
disease?
saliva.
This will tell
So
us the levels,
we need
whether
to
they
look
are
at
normal
the
or
hypothalamic
abnormal
pituitary
in
adrenal
terms
axis.
of
So we need
levels
to look at the levels
which
of
are telling us
cortisols
whether
and
there is
ACTH
an increase
in the blood, but also
hypothalamic
in the
pituitary
urine
adrenal
cortisol
axis
and also
abnormality.
in the saliva.
This will
So
tell us
what
the
we
levels,
perform
whether
is
they
a
are normal
dynamic
or
test.
abnormal in
So
terms
we can
of
stimulate
levels
or suppress
which
in this
are
dynamic
telling
test.
us whether there is an increase
And we will
in the
explain
hypothalamic
what is the
pituitary
dynamic
adrenal
test.
axis
Remember what this
abnormality.
means, right? So what we
Dynamic
perform
testing
is a dynamic
involves using
test.
intervention
So
which
we
should
can stimulate or
which should
suppress
change
in
the levels
test.
of the hormone. Okay?
And we will explain what is the dynamic test. Remember what this means, right?
So let's say that we suspect
Dynamic
that
testing
a hormone
involves
has
using
an excess.
intervention,
For example,
which should
there is an excess
which
of
should
ACTH.
change the levels of
the
the
dynamic
hormone.
test is
Okay?
designed to suppress the hormone synthesis and secretion. Failure to suppress, so let's say that we suspect that a hormone has an excess.
abnormal
For example,
secretion.
so let me
There
say
is
that there is a tumor that produces too much ACTH. The
in the
dynamic
pituitary.
test is designed
So the tumor
to suppress the hormone synthesis.
we try
and
to block,
secretion.
to suppress, but there
Failure
is
to
continuous
suppress
increase
indicates that there
expression
is
of
this
abnormal
hormones,
secretion,
right?
So
let's say
so
that,
that
means
means
that
that
there is a
produces
pathological
too much
hormonal
ACTH
production
in the
of
pituitary.
these hormones.
So the tumor,
To test this,
we try to block, to
we know
suppress,
a
but there is
suppression
continuous increase.
Another
expression
example, for
of
example, is
these
the use
hormones,
of dexamethasone
right?
suppression.
So that means that there is a pathological
cortisol
hormonal
excess.
production of these hormones.
Let's say, on the other scenario,
to test
that there
this,
is, we suspect insufficient
we know a
or
suppression
deficiency
test of that particular
Another
hormone.
example, for
Then
example,
the dynamic
is the use
test
of
designed
dexamethasone
is to
suppression
stimulate that particular
for
hormone.
cortisol
For example, if
excess.
it's ACTH, you will produce
Let's say on the other
CRH,
scenario
corticotrophin,
that there is
we
suspect
suspect
insufficient
and
or
then we will
deficiency
try to
of
as
that
that particular
particular
hormone.
produce.
Then the
Failure
dynamic
to increase
test
the
design
levels
is to stimulate that
confirm
particular hormone. For example,
hormonal
if it's ACTH,
deficiency.
you will produce CRH.
So this test is known
corticotrophin
as
a stimulation
releasing
test.
hormone.
And then
One
try
example that
to
we will see
as
is
the
the
pituitary to
synaptin
produce.
for cortisol
Failure to
deficiency.
increase the levels.
Not we are studying now
Hypersecretion of cortisol, but we will
hormonal
look at the
deficiency.
synaptin tomorrow.
So this test
So
is
assessment
known as
of
a
the
stimulation
HP,
test.
basal, blood.
One example
Obviously,
that we
the
will
important
see
is the
synaptin
timing
for
the
cortisol
circadian
deficiency.
rhythm, and
Not we are
also
studying now
the ultra,
hypersecretion of cortisol, but we will
rhythm
look at
and
the synaptin
obviously
tomorrow.
the stress.
Also,
So
the
assessment
samples can
of
be
the
done
HP
by
basal,
blood
urine test.
obviously, the
24
important
hours
is
collection,
the timing,
the circadian rhythm,
and look
and
at different
also
areas,
the
under
ultra
and predisposed
Jan
curve of
rhythm,
level.
and obviously
Also,
the
saliva
stress.
sample.
Also, the
and
samples
obviously
can be done.
that
That
what
what
is
is important is that the
urine
patient is
test,
not under
24
stress
hours
and the
collection.
timing. So dynamic tests
And
include
look at different
stimulating
areas under
and you can
predisposed
stimulate
curve of
by
level.
adding ACTH
Also,
hormone,
saliva sample
and
corticotrophin
obviously
releasing hormone.
that what is
hypothalamic,
important is that the patient is not
producing
under
a stress
and the timing.
or
So
hypoglycemia,
dynamic test
which as we
include
know,
stimulating
hypoglycemia is
and you can
important because
stimulate by
what
adding
the
ACTH
hormone
produces is actually the reverse.
corticotrophin releasing hormone hypothalamic, producing a stress or hypoglycemia, which as we know, hypoglycemia is important because what the
Very
ACTH
important.
produces is actually the reverse. And then the suppression test, we use drugs such as dexamethasone. Okay? So let's do the investigation for confirm Cushing's disease. So we have a patient that has all the features
important.
of Cushing's, like has gained weight.
And then the suppression test, we use drugs such as
facial
dexamethasone.
moon phase.
Okay,
Has
so let's do the
pigmentation,
investigation to
has lots of
confirm
abnormal
Cushing's disease.
metabolism,
So we have a patient
lot of fat
that has
and
all
has
the
also
features
psychological
of
problems
Cushing's,
like due to
has gained
excess
weight,
corticoids
has also
and stress response.
facial moon
If we
phase,
remember here, this
has
is
pigmentation,
the levels of
has
cortisol
lots of
during the day.
abnormal metabolism.
So we have
lot
at
of
midnight
fat, almost
and
zero
has
when we go
also
to bed,
psychological
and then we have a
problems
peak at
due
8
to excess
in the morning,
corticoids,
right?
and
That
stress
it's increase
response.
of, if we
Um,
remember here, this is the
cortisol,
levels of cortisol,
and this is very
during the day.
important because it
So we have
starts
at
awake
midnight
the day.
almost zero when we
Remember?
go to bed,
And
then
also
we
it will
have
generate
a
a lot
peak
of
at
glucose.
8 in the morning,
Because we need to start
right?
getting
That
on with the
it's
day.
increase
We need to get
of
the train. We need to go to school. We need to go to university. So peaks of cortisol. And this is very important,
as you can see,
because it
have
starts
a
awake
circadian
the day.
rhythm between sleep
Remember?
and awake,
And
we
also
can
it
see
will
here
generate
high
a lot of
levels
glucose.
cortisol. Okay,
Because we need to
the
start getting on with the
cortisol
day.
also
We need to
with
get
levels
the train.
of
We need to go to
ACTH.
school. We need to go to
Okay?
university. So peaks of cortisol.
So are, as you can see,
the investigation
have a
will be
circadian
24
rhythm
hours
between
during
sleep
cortisol
and awake,
test.
and we can see here high
Midnight
levels of
cortisol
test.
Okay.
With saliva.
The
first
cortisol
is 24 hour
also
urine.
with levels of ACTH.
Second test, midnight cortisol.
Okay.
So if you remember midnight,
So,
right, which is here,
The
midnight,
investigation
the level
will
should be very
24
low.
hours during cortisol test.
Okay. In the morning,
Midnight
should be very
cortisol
high.
test.
With saliva. The first
Then
is 24 hour
suppression
urine.
test with low
Second
dose
test, midnight
dexamethasone.
cortisol. So if you remember midnight,
And then
right,
a
which is
stimulating
here,
test
midnight,
with
the level
CRH
should be very
of
low.
corticotrophin releasing hormone
Okay.
test.
In the morning,
And then
should be very
laboratory
high.
blood, urine, and electrolyte analysis.
Then, as you know,
suppression test with low
cortisol
dose levels affect
dexamethasone.
multiple. Like for example,
And then
the absorption of
stimulating
sodium
test
in the
with
kidney,
CRH
electrolyte
of
analysis
corticotrophin
will come up
releasing
abnormal
hormone test.
if there is too much cortisol.
And then laboratory
Okay?
blood, urine,
we will
and
go now
electrolyte analysis.
one by one,
as you know,
in each of
cortisol
these levels
okay?
affect multiple. Like for
So,
example,
the 24-hour
absorption
urine,
of sodium
free
in the
cortisol
kidney,
test.
electrolyte analysis
Ideally
will
will
come
be
up
3 collections
abnormal
measured,
if there is too
also
much
creatine.
cortisol.
Why creatine
we
is
will
measured
go
in
now
lot of the blood,
one by one
of other
in
of urine
each
test.
of these
Because
ones,
creatine
okay?
is a protein from muscle
So the
that
24
normally is
hour
secreted
by
cortisol
by the kidney.
Ideally will be
So
3
a lot of
collections
tests like
measured,
for diabetes,
also creatine.
a lot of tests
Why
for blood
creatine
tests
is measured
also
in lot of
include
the
creatine.
blood
If
of other
creatine
of urine
is
test.
abnormal,
Because
that
creatine
means that there is
is
a problem with
protein
the
from
kidney
muscle
function
that normally
okay?
is
and maybe then you
secreted
need to repeat
by
the test by the kidneys.
So Cushing's
So a lot
syndrome,
of tests like
if
for
2
diabetes,
or more measurements
a lot
are
of tests
higher
from
than
blood
3
tests
times
also
the upper
include a
limit of
creatine.
normal.
If
Right?
creatine
You will
is
consider
abnormal,
this.
that
Guys,
means
you
that there
don't
is a
need to
problem
know
with the
this.
kidney function.
This is just to
okay?
give it an example.
And maybe then
now.
you need to
All that you
repeat the
need to
test.
know
Is that the 24-hour
So Cushing's
urine-free
syndrome,
cortisol
if 2
needs to
or
be
more
elevated,
measurements are
and
higher
that
than
it's
3
done
times
the upper
fasting
limit of
and
normal
during collection,
right? You will
right?
consider this.
And
But
guys,
you don't need to know
specific
this for
this
the
is just to
exam
give it an
of
example
concentration.
now. All that you need to
okay?
know, this is
that
just
the
for your
24-hour
own information
urine-free cortisol
to know
needs
the
to be
ranges
elevated,
of and that it's done
actual
fasting
and during collections.
if
right?
the creatine
But you don't need
varies
to know
between
the specific
experiments or
for the
collections
exam
of
let's say by
concentration,
more than a 10%.
okay? This is
you
just
need
for
to
your
repeat
own
the test because that
information
may
to
tell you
know
that
the
there is
ranges
an
of
abnormal
the
creatine
actual test.
Abnormal liver
If the
abnormal
creatine varies
kidney
between
function.
experiments or
There are
collections,
also false positives.
let's say by
to this
more than a
urine test.
10%.
For example,
you need to
during
repeat the test
pregnancy,
because that may tell
right?
you that
there
there
must
is
be
an
there could be
abnormal
a different reading.
creatine,
anorexia,
also
abnormal
like
liver,
very
abnormal
extreme
kidney
exercise
function
because puts
there are
five
also
hormone
false
and
positives
ACTH
to this urine test.
higher.
For example, during
also some drugs
pregnancy,
for psychosis.
right? There
and
must
also
be, there could be
alcohol
a different reading.
and alcohol withdrawal
anorexia,
syndrome.
also like
very
now the
extreme
second test
exercise
or the
because
cortisol levels at
5
for
hormone and ACTH
higher.
also
So
some drugs for
normally
psychosis
and also alcohol. These cortisol levels
alcohol
are taken
withdrawal syndrome
from 11 p.m. to 1 a.m.
Now, the second
as we have
test,
shown in
or
the graph,
cortisol
is when
levels
the
at
cortisol
midnight.
levels are very low, and is when ACTH levels are very
So,
low. Normally, in normal
these
cortisol levels
at midnight during
from
the sleep
11 p.m.
are
to 1
almost
a.m.
undetected,
as we have
in
shown
normal
in the
individuals.
graph. Is when
What
the
happens if
cortisol
you have a
levels
tumor
are very low,
that produces
and
too
is
much
when
ACTH?
levels
We will
are
see.
very low.
What happens if you have a pituitary tumor?
In
have
normal
too much
individuals,
ACTH?
cortisol
What
levels
will happen
at midnight
is that the
during the
adrenal
sleep
will
are
produce too much
almost
cortisol.
undetected.
So that will
In
come up
normal
on the
individuals.
test. What happens if you have a tumor
These tests are difficult
that produces
to
too
perform
much
because
ACTH?
represented with
We will
cannula,
see.
and patient needs to be
What
admitted
happens
to
if you have a
hospital,
pituitary tumor
and
have too much
also
ACTH?
the patient needs
What
to
will
be
happen
relaxed,
is that the
because
adrenal
if you are
will
not
produce
relaxed,
too much
you produce
cortisol.
more ACTH
So that will come
and
up
more
on the test.
cortisol, right? So the patient should not
These
be
tests
aware
are difficult to perform
about
because
having
represented
this
with
test.
cannula,
Okay.
and patient needs to be admitted to
Alternatively,
hospital,
sample can
and
be taken
also
immediately.
the patient
after
needs to be
waking up,
relaxed,
because
before
if you are
the
not
HP
relaxed, you
adrenal
produce more
axis has time
ACTH
to increase
and more
the
cortisol, right?
cortisol
So the
secretion.
patient should not be aware, one, about having this
If
test.
taken with
patient
okay,
is asleep,
alternatively,
normal cortisol
sample
can be taken immediately after waking up, before the HP adrenal
although it
axis
is
has time to increase
inconvenient
the because the patient
cortisol
needs to
secretion.
stay at night and obviously needs to be in a relaxed.
If
This is a
taken with
very
patient
reliable
is asleep,
test for Cushing's
normal
syndrome,
cortisol should be.
and obviously it is recommended, right?
Although it is
Also, there is an
inconvenient
option to do
because
late
the
night
patient needs
salivary
to stay at
cortisol
night
measurement,
and obviously
a
needs to be in a
simple,
relaxed.
reliable
This is a
screening
very
test for
reliable
Cushing.
test for Cushing's syndrome, and obviously it is recommended.
Then what
Right?
about the suppression test? Low dose dexamethasone
Also, there is
suppression
an
test.
option to do late
So
night
there are two types:
salivary
overnight
cortisol
low
measurement
dose, a simple,
and the standard
reliable
low dose
screening test,
right?
for Cushing.
So by basically what they do is
then what about
treat the patient
suppression
with
test,
dexamethasone,
low dose
and
dexamethasone
then look at the
suppression
plasma
test.
cortisol.
So there are two
right?
types: overnight
And
low dose,
look at whether the levels
and the standard
are
low
normal
dose,
or within
right?
range.
So by basically
With
what
the
they
standard
do
low
is
dose
of dexamethasone,
treat the patient.
the
with
patient is
dexamethasone,
treated for,
and then look at the plasma
6
cortisol
hours
right?
for 2 days,
and look
of
at whether the
0.0
levels
of
are
dexamethasone
normal or
so
within
for
range.
8 doses. So
With the
it's
standard
through
low
a long
dose
time
of
right?
and
And
dexamethasone,
that should
the
suppress
patient is treated
cortisol
for,
and then
they
6
look at
normal
hours for
urinary
2 days
free cortisol
of 0.0 milligram of
different,
dexamethasone.
so
days.
for 8
And this
doses.
should be also
so
within the
it's
normal
through
range,
a long
depending
time,
whether
right?
there is a tumor
And
or
then
not tumor.
that should suppress cortisol.
Also, we
and
need
then
to be aware of
they
mild
look
Cushing's
at
syndrome,
normal
which is difficult
urinary
to distinguish
free
normal cortisol
in
secretion
different
from pseudo-Cushing's syndrome.
days. And this
Because
should be
it
also
can give
within the normal
false
range,
or negative
depending
results.
whether there is a tumor or not tumor.
Pseudo-Cushing's syndrome can
Also,
be
we
due,
need to be
for
aware
example,
of
to
mild
external
Cushing's
syndrome,
reasons,
which is difficult
right?
to distinguish,
which are
normal
not related
cortisol
to a pituitary
secretion
tumor
or
or a
pseudo-Cushing's
tumor in the
syndrome,
adrenal gland,
because it
and
can,
it can
be related to,
false
for example,
or negative
depression,
results.
alcoholism, and
Pseudo-Cushing's
syndrome
can
give
due,
Cushing's
for example,
appearance.
to external reasons, right?
Also,
which are not
the
related
press
to a
phase of
pituitary
affective
tumor
disorder
or a tumor in the
withdrawal
adrenal
from
gland.
alcohol
And it
intoxication,
can be related
and
to,
also,
for example,
depression,
alcoholism,
eating disorders
and
such
also,
as anorexia and bulimia, can give
you
Cushing's appearance.
also
Some the press
types
phase of
of
affective disorders
or some
withdrawal
rhythms
from
which
alcohol
look
intoxication,
like
and
Cushing's
also, for
disease,
example,
but they are not. Okay?
eating disorders such as
These
anorexia
conditions may
and
have
bulimia
biochemical features
can
of
give
Cushing's syndrome.
and
For example,
also,
the main
some
feature of
types
like depression
of
or alcohol
some withdrawal
rhythms or
which
anorexia
look is
like Cushing's
elevation
disease, but they are
during
not.
free cortisol.
So there must be
These conditions may have biochemical features
a lot of
Cushing's
free
syndrome.
cortisol, and for example, the main
And obviously something to
feature
take into
of like
consideration,
depression
and
or
also
alcohol
disruption
withdrawal
of normal
or
diurnal pattern
anorexia
of cortisol
is Okay.
Elevation urine free cortisol.
So on the test,
there must be,
you should always look for
a lot of free
external
cortisol
exposure.
right?
One,
And obviously something to take
medication
into consideration
with cortisol,
and also
disruption
or
of
other
normal
medications,
diurnal
but
pattern of
also
cortisol.
okay,
Other syndromes.
So on the
such
test,
as for example,
you should always
anorexia,
look for
depression,
external
alcohol
exposure
and alcohol withdrawal.
okay,
Medication,
and this
with
can give you also
cortisol
false
or
positives.
other medications, but also
In here you have normal cortisol
other
reference
syndromes
range.
such as,
You
for
don't need
example,
to know this by the exam.
anorexia,
But is
depression,
when you become
alcohol,
a doctor,
and
this is
alcohol
what is used
withdrawal.
as parameters,
Okay?
right?
So
and
if
this
we
can
look
give you
cortisol
also
in
false
serum,
positives.
cortisol in urine,
right?
In
And
here
this
you
is
have normal
the difference.
cortisol
AM in the
reference
morning
range.
and PM
You
at
don't
night,
need to know this by the
right?
exam.
And then
But
we can
is
see
when
here
you become a
in
doctor,
serum
this
and
is what
free
is used
circulating
as
okay?
parameters.
And those
right?
are
So
the
if we look
normal
cortisol
ranges.
in serum,
From 8
cortisol
to,
in urine,
right?
and this
25.
is the difference.
There is a
AM
conversion
in the morning
factor,
and PM
right?
at
And then
night,
it gives you the
right?
nanomole per liter.
And then we can see
right,
here
which is
in
between
serum
2 to
and
1
free
to 6900
circulating,
nanomole.
okay?
And those
obviously
are the
normal
PM
ranges
from
8
110 to
345,
25,
right?
And
then
there
there
is
is conversion
also the
factor,
free
right?
cortisol.
And
So
then
this
it
is
gives you the
used
nanomole
as
per
parameters,
right?
in
Which
the
is
normal
between
units
2 to 1
and
to 6
free range
nanomole,
cortisol,
and
right?
obviously
Not
at
only
PM
from
in the morning and
110
in the night,
to
but
345,
also in the urine,
right? And then
at
there is
different
also
ages
the
because
free
it changes.
cortisol. So this
for
is
ages.
used
Adult
as
children,
parameters.
you can see
in the
different
normal
levels of
units
cortisols
and
and,
free range
cortisol,
cortisol,
and the
right?
ranges
Not
of the
only
24 hours
in the morning and in the night,
but
So,
also in the urine.
we have
at
talked,
different
right,
ages because
about
it
the
changes
different tests.
for
So this
ages.
one is the
adult
stimulating
children
test.
You can see
of
different levels
adding
of cortisols,
the
corticotrophin releasing hormone,
and the
and the
ranges
corticotrophin
of the
releasing
24
hormone,
hours.
remember, is from the hypothalamus,
So,
right? And
we
will
have
stimulate,
talked, right,
production
about the
of
different tests.
ACTH.
So
in
this
the
one is the
anterior
stimulating
pituitary gland.
test of adding
So what is used?
the
Corticotrophin
is
releasing
0.9
hormone.
microgram
And the
per kilogram of
corticotrophin releasing
human
hormone, remember, is from the hypothalamus,
right?
And then
and there
will
is a blood
stimulate
test assay
production
for
of
ACTH
ACTH
in the anterior
production,
pituitary gland.
right? And cortisol. And
So
this
what is used
produced
at
is 0.9
15 minutes
microgram per
before,
kilogram of human,
and
then
CRH,
different samples are
and
taken
then
and
there is
measured
a blood
at
test
0,
assay
15,
for
30, 60, 90,
ACTH
120
production,
minutes,
right?
and cortisol. And
Now,
this is
if
produced
you see an exaggerated response,
15 minutes
indicates
before,
pituitary
and then
dependent Cushing's disease.
different
So a
samples
pituitary
are
tumor.
taken and measured
Okay.
at 0, 15, 30,
A flat
60,
response
90,
indicate
120
ectopic
minutes.
ACTH production.
Now,
Not commonly
if
used,
you see an
it is
exaggerated
not-
response,
it depends on countries,
indicates
but is an expensive
pituitary
test.
dependent,
But we
Cushing's
can
disease.
see here the
So a
responses
pituitary tumor
of the levels
Okay.
of ACTH.
A
in
flat
the
response
ACTH
indicate
to
ectopic
CRH
ACTH production.
What you can see
Not
is
commonly used
in
it is
the
not-
y-axis
it depends
ACTH,
on countries,
but is an expensive
picomole,
test, right?
but
per
we can see
liter.
here the responses
And what we can see
of the
is
levels
of ACTH
and
in the
control
ACTH response to CRH.
Okay, so we have
What you
control
can
levels,
see is, and then
in
we have
the y-axis
increased
injection
injection
of
of CRH,
picomole,
and we can see
right per
increase,
liter,
and what we can
of
see is ACTH in response
and
to CRH.
control. What happens in
Okay.
Cushing's?
So we have
Right?
control levels
When there is a
and then we
pituitary
have
tumor,
increased
right?
injection
There is a
of
tumor that
CRH,
produces too much
and we can see
ACTH.
when we
Increase
put CRH,
of
there is an exacerbated
ACTH
increase
in response
on
to
production
CRH.
of
What happens in
ACTH
Cushing's?
in the blood,
Right?
when there is
Because it's a tumor that
pituitary
responds
tumor to CRH.
right?
There
And
is
this
a
is telling
tumor
us
that produces too
that
much
the
ACTH.
tumor comes from the
when we
pituitary
put
gland,
CRH,
right?
there is
If
an
you compare to
exacerbated
ectopic
increase
ACTH,
on
is always
production
flat
of
because it does not respond
ACTH
to
in the blood,
CRH in the hypothalamus,
because it's a tumor that
but
responds
is just
to CRH,
normal levels.
and this is telling us
always high.
that
the tumor comes from the pituitary.
If we have
gland.
an adrenal
Right?
adenoma,
If you compare
it does
to
not
ectopic
affect
ACTH,
is
the
always
ACTH,
flat
because
what
it does
happens
not
in the
respond
adrenal
to
adenoma is that we have
in the
too much
hypothalamus,
cortisol,
but it's just
right?
normal
And
levels.
too much cortisol,
always high.
remember,
If we have an
inhibits
adrenal
the production of
adenoma,
ACTH.
it does not affect
Okay?
on the
So if we go back
ACTH.
into the
What happens
presentation,
in the adrenal adenoma,
maybe I should
is
have
that
put
we
this in
have
here.
too much
Okay?
cortisol, right?
Let's
And
see.
too much cortisol,
When
remember,
we have
it
adrenal,
inhibits the production of ACTH. Okay? So if we go back into the presentation, we have an adrenal
Maybe I
tumor
should have put this in
produces
here.
too much cortisol,
Okay?
but when we add CRH,
okay,
when we have a adrenal,
when we add CRH,
okay,
this is inhibited by the cortisol, and the levels of ACTH are inhibited.
we have an adrenal
for
tumor
negative feedback
produces too
from
much
the
cortisol, right?
But when
so
we
that's
add
why
CRH,
when there is an adrenal
okay,
tumor that produces too much cortisol,
when we add
doesn't
CRH,
matter if
this
we
is
activate
inhibited
with
by the
CRH,
cortisol,
because these two
and the
are
levels of
negatively
ACTH are
controlled
inhibited
by the
for
tumor
negative
itself,
feedback
from
okay?
the cortisol.
So,
Right? So that's why when there is an adrenal tumor,
if we look at this
that
graph,
produces too much cortisol,
it's normal
doesn't matter
that
if we
in the
activate
adrenal
with
adenoma that
CRH,
produces too much
because
cortisol,
these two are
right?
negatively
The levels
controlled
of
by the
ACTH
tumor itself,
are
okay?
always
So
negatively regulated.
okay,
And they are always
if we
low.
look at this graph,
Okay? It's
now,
normal
what happened
that in the
to the
adrenal
cortisol?
adenoma that produces too
we
much
measure
cortisol,
here ACTH,
right?
Now
The
we
levels
measure
of
the cortisol
ACTH
to
are
CRH.
always negatively regulated.
What we can see is
okay?
non-treatment
And they are always low.
time
Okay?
zero.
We add
Now, what happened
CRH
to the cortisol?
and in
we
the
measure
control,
here ACTH. Now we
CRH
measure the cortisol response to CRH.
will produce an increase in ACTH,
What we
but
can
also
see
this
is
ACTH will increase
non-treatment cortisol
time zero.
circulating cortisol.
We add
right?
CRH,
What happens
and in the
if
control,
we have an adrenal adenoma,
CRH
which produces too much cortisol?
will
Cortisol
produce
will be always
an
elevated,
increase in ACTH,
independent
but also this
of
ACTH will
CRH
increase
stimulation. Cortisol,
right?
circulating
In
cortisol.
Cushing's,
we can
right?
see it's elevated.
What happens
and
if we
if
have
there is
an
an
adrenal
ectopic
adenoma,
tumor in
which
the lung
produces too
or
much
somewhere
cortisol,
else that produces ACTH,
cortisol will be always
that
elevated,
will not respond to hypothalamic
independent
CRH.
of CRH stimulation.
Okay?
Right?
Very, very,
In
very
Cushing's,
important.
we can see
to understand
it's elevated,
the dynamics.
and
If there is an
so,
ectopic tumor
other
in
laboratory
the lung
findings
or somewhere
as
else
number
that
5,
produces ACTH,
as we saw,
that will not
ACTH
respond to
increasing
hypothalamic CRH.
impacts on the
Okay?
production of
Very,
cortisol,
very important to
and
understand the
cortisol
dynamics.
has many physiological
So,
functions. We said
other
in the
laboratory
system,
findings
but
as number
also
5.
in the kidneys,
As we
and
saw,
also
ACTH,
diabetes,
right?
increasing.
So,
Another
another
on the
findings
production
in the blood
of
that we can
cor-
find
cortisol
on Cushing's disease
is
and
raised
cortisol
in white
has
blood
many
cells
physiological
because there is an
functions. We
immune
said
response,
system,
but also
hypokalemia
in the kidneys,
right?
and
so
also
this is
diabetes,
common with
right?
ectopic ACTH.
So, another
also metabolic
findings in the
alkalosis
blood
that we can find on Cushing's
hyperglycemia
disease, as we
is
have
raised
studied
in
and I
white
showed you
blood
before,
cells,
increase
because there is
in
an immune
ACTH,
response,
increases cortisol
hypokalemia,
levels,
right?
and this increase
So
in cortisol
this is
levels,
common
what
with
it
ectopic
produces
ACTH
is to
also
deliver
metabolic
to produce
alkalosis,
more
hyperglycemia
glucose
through
we
gluconeogenesis
have
pathway.
I showed you before,
and then
increase in
plasma
ACTH,
LDH
increases
because it affects
cortisol
lipogenesis.
levels, and this increase
Okay?
in cortisol
So
levels,
if you have
what it
these
produces
5 days,
is to
these 5 days
deliver to
are
produce
indicative
more
of Cushing's disease.
glucose through
So,
gluconeogenesis
summary
pathway.
of the diagnosis
and then
of
increase in
Cushing.
plasma LDH,
So we
because
can
it affects
suspect
lipogenesis.
Cushing's syndrome
Okay,
based
so
on
if you have these
the
5 days,
these 5 tests
that we just
are
mentioned,
indicative
right,
of Cushing's disease.
gain of weight,
So,
striata
summary
in
of the
belly,
diagnosis of
lots
Cushing's.
of body mass,
So
BMI,
we can
high
suspect
increase in
Cushing's
BMI,
syndrome
feeling
based
unwell,
on
moon
the
face,
features
ectopic hair,
that
ectopic
we just
pigmentation.
mentioned.
right?
First thing we need to do
Gain
as
of
doctors
weight
is to exclude exogenous steroid
lots of
use.
body
Is
mass,
the patient
BMI,
this
high
way
increase
because he's
in
taking too
BMI,
much steroids,
feeling
because has
unwell,
asthma,
moon
face,
face, ectopic hair,
eczema,
ectopic pigmentation,
right? First
Very,
thing
very,
we
very
need to do
important.
as doctors is to exclude exogenous steroid use. Is the patient this way
Then,
because he's
if
taking
we
too much
have
steroids,
excluded this,
because has
perform
asthma,
one
because
of this
ectopic
test.
eczema,
The late night salivary
right?
cortisol,
Very, very, very
okay?
important.
And as we know, at
So,
nighttime cortisol should be low. Okay, so if you see very high levels of cortisol
then
in
if
salivary,
we have
then
excluded
24-hour
perform
urine-free cortisol
and
of
the
this
dexamethasone
test,
suppressant
the late
test.
night salivary
Okay?
cortisol.
If these tests are
negative, and as
Cushing's
we know,
syndrome is unlikely.
at nighttime cortisol should be low. Okay, so if you see very high levels of cortisol in salivary, then 24-hour urine-free cortisol
physiological
and the
causes,
dexamethasone suppressant
right?
test, and the tests are positive.
If
which
these tests
are
are
the
negative,
physiological causes?
Cushing's syndrome is
Mental
unlikely.
illness,
Okay?
stress, anorexia, depression, all these things, right? Which can influence
have
in the
excluded
ACTH
physiological causes,
corticosteroid
right?
pathway.
And the tests are
Then
positive.
confirm
Which
positive
are the
tests,
physiological causes?
perform one or
Mental
two additional
illness,
studies, negative
stress,
Cushing's syndrome unlikely,
anorexia,
positive Cushing's
depression,
syndrome,
and
all
measure
these things,
plasma
right? Which can
ACTH.
influence in the
Okay?
ACTH corticosteroid
So
pathway.
physiological causes
Then
of
confirm positive tests.
hypercholesterolism, as I
Perform
said, there
one
are
or
lots
two
of other
additional
physiologicals here,
negative
which
Cushing's
is not
syndrome
related
unlikely,
to a pituitary
positive
tumor,
Cushing's
neither
syndrome,
related
and
to
measure
an adrenal
plasma
tumor.
ACTH.
Depression, alcoholism, the
Okay?
first phase of affective disorder, withdrawal from
So
alcohol,
physiological causes
intoxication,
of
eating disorders such as anorexia and
hypercholesterolism,
bulimia.
as I said, there are lots of
And
other
these conditions may
physiologicals
have
here,
biochemical
which
features
is not related
as,
to a
for
pituitary
example,
tumor,
neither related
Cushing's syndrome,
to an adrenal
including
tumor,
depression,
depression, alcoholism, the
urine,
first phase of
free
affective
cortisol,
disorder,
disruption of
withdrawal
normal
from alcohol,
diurnal pattern,
intoxication,
cortisol, secretion
eating
lack of
disorders such as
suppression,
anorexia
cortisol,
and bulimia.
and after over
And these conditions
night,
may have
1
biochemical
of the
features
dexamethasone suppression
as,
test.
for example,
Then,
Cushing's syndrome, including
important,
elevation
right?
of urine,
Plasma
free
ACTH,
cortisol,
investigation
disruption
of
of identified
normal
causal
diurnal
pattern
syndrome.
cortisol, secretion lack
Pulsatile
of
secretion
suppression
with
cortisol,
diurnal variation,
and after over
highest at
night,
night, 1
lowest
milligram
at
of
midnight.
dexamethasone suppression
Undetectable
test.
plasma of ACTH
Then,
with high serum cortisol.
Important,
ACTH independent
right?
Cushing's syndrome,
Plasma ACTH,
adrenal adenoma,
investigation to
carcinoma,
identify Cushing's
and
syndrome.
also ectopic
Pulsatile
should
secretion
be
with
followed by
diurnal
an
variation.
abdominal,
Highest
CT
at
scan
9
or
m, lowest
MRI
at
scan,
midnight.
if not
Undetectable
obviously
plasma of
ectopic.
ACTH with
If
high
plasma
serum cortisol.
ACTH is detectable,
ACTH independent Cushing's syndrome,
because maybe
adrenal
if
adenoma
plasma
carcinoma,
ACTH is
and
detectable,
also
an increased
ectopic,
level
should
may
be
followed by
suggestive
an
of
abdominal,
pituitary tumor.
CT scan
So,
or MRI scan, if not
if plasma ACTH
obviously
is
ectopic.
detectable, the following
If plasma
are
ACTH
indicative.
is detectable,
High dose
see next
dexamethasone,
slide, because maybe
right?
if
Suppression
plasma
test.
ACTH is detectable,
There are two
an
types,
increased
as
level,
we said,
may be
right?
suggestive
One
of
is
a
to
pituitary
produce
tumor.
a high level
So,
of dexamethasone at 11 p.m.
If plasma
and then
ACTH
obviously
is
there should
detectable,
not
the
be
following
cortisol, but
are
because we are
indicative.
doing a
High
further
dose
suppression test
dexamethasone
to look at the
right?
plasma
Suppression
cortisol
test.
at 8 a.m.
So
there
you
are two
inject
types, as we said,
dexamethasone at
right?
11,
One
and
is
then
to
look
produce
plasma test,
a
right?
high level
They
of
should be
dexamethasone
suppressed,
at 11
but
p.m.
if there is a
and
problem,
then, obviously,
right,
there should
level
not be
should be
cortisol,
high.
but because
If
we
shell-
are
if
doing
levels
a further
of that
suppression
hormone
test
are
to look
high,
at the plasma
despite the
cortisol at
dexamethasone,
8 a.m.
right?
So
that
you
means
inject
that there is an ectopic
dexamethasone at 11
of
and then
a
look plasma test,
source
right?
of ACTH.
They should be suppressed.
Collect
But if
urine
there is a problem,
over 3 days,
right?
for
Levels
cortisol,
should be high.
and
If shell
also produce
if
dexamethasone
levels
of that
for
hormone
2 days
are high,
8 doses,
despite
and as we
the
said before,
dexamethasone,
look at the levels
right?
of cortisol.
That means that there is
right?
an ectopic
So 9
of
over 90%
source
reduction
of
in the
ACTH.
baseline urinary
Collect
cortisol
urine over 3
that
days
means
for
that there is a
cortisol,
pituitary
and
adenoma.
also produce dexamethasone
Okay.
for 2 days.
The reason
8
is
doses,
because you
and as
are
we said before,
suppressing,
look at the levels
okay,
of
the
cortisol,
baseline,
right?
and the pituitary adenoma,
So
if
9
no change or
over
suppression,
90%
suggests
reduction
also
in the baseline
ectopic
urinary
production
cortisol.
of ACTH.
That means that there is a pituitary adenoma.
There is another test which is inferior. The reason is because you are suppressing, which basically is performed with and the pituitary adenoma of no change corticotrophin releasing hormone, also ectopic and basically those are the baselines. But then what it's done is imaging. There is another test which is inferior for Cushing's, potrosol sinus sampling, or MRI for adrenal performed with a stimulation of there is a chest and abdominal scan for patients suspected to have the adrenal or the baseline. But then what it's done is imaging also MRI of the pituitary for inferior and CT or MRI for adrenal. So basically is putting in the jugular vein, a chest this and vein abdominal scan here for patients suspected to have the adrenal and then or stimulate with CRH, corticotrophin releasing hormone. This will make the pituitary obviously to produce more. So basically is so the sample can be taken with a catheter. This vein goes from here into the pituitary and look at the levels of stimulate with CRH, corticotrophin so once we have detected, this will make the pituitary that there is obviously to produce more ACTH. Producing so the sample can be taken with a catheter from here from the pituitary and then look at the levels of ACTH. There is so once we have detected that there is transphenyl surgery. You can see here in this producing too much before they were doing craniotomy, so opening of the cranium. But now, then the operation of the pituitary gland is through an endoscope. There is, and then the endoscope also goes through the nose and takes the part of the transphenyl surgery. You can see here in this tube, there is the before they were doing craniotomy, so opening of the pituitary gland. But now there is the operation of the pituitary gland, and is through an endoscope. And then the endoscope goes through the nose and takes the part of the tumor in the pituitary. You can see here, there is the cancer, the tumor, so surgical, pituitary gland, the cause, and then normally there is breakage if there is sphenoid bone, adenoma, which is big, primary treatment obtention, usually curative, transphenyl adenectomy, so taking the tumor through the nose with an endoscope. So also surgical, if there is too much on the cause, normally if there is like for example adenoma, which is big case of a tumor in the adrenal gland, it's transphenyl removal of adrenal by surgery, so taking and this can be bilateral or unilateral endoscope, or where the tumor also is, if there is so too much ACTH, of course, also pituitary like radiotherapy, in the which will case be of radiation tumor, in the part of the adrenal gland has it's the removal of adrenal. There are also pharmacological treatments, and this can be bilateral or preparation for surgery or is adjunct so that will be adrenal surgery, right? And also pituitary radiotherapy, which will be radiation in the part of the pituitary that has most of them are enzyme inhibitors. There are also pharmacological treatments, catechisonol, preparation for surgery or adjunct after the surgery, and and these you don't need to know the names. Affect these enzymes work in the pathways that we have studied. Most of them are enzyme inhibitors of cortisol. Also adrenolithic like mitoten, which is a delayed onset by long lasting, and trilosartan. Remember, you don't need to know the name of the mechanism these enzymes of cholesterol biogenesis that we have studied on important production of cortisol. Are all these enzymes. Also adrenolithic like mitoten. If there is overproduction of corticosterone or cortisol, of the mechanism work at different levels of the biogenesis. So, for example, there is too much cortisol. If you want to stop the pathway at the cholesterol level, if there is overproduction of corticosterone, but if you want to stop cortisol, at these drugs work at different levels of the pathway. And so, for example, these names, there is too much cortisol. That all these compounds are used. If you want to stop the pathway at the cholesterol in the production, you can use cortisol, right? And in the production, but if you want to stop at these androgens, methyrazone, ketoconazole, in blue, and you don't need to know these names, but just know that each all these compounds are used on that the pathway studied in the production of cortisol, corticoids, right, and in the production of other. So just to summarize, such the management of Cushing's disease. right?
If you have a patient of Cushing's,
and each one has a specific effect on that pathway that we studied.
Remember,
of
disease
the production
means
of
that
mineralocorticoids,
is secondary.
glucocorticoids, and
Secondary
androgens.
means pituitary.
So
Primary
just to
means
summarize,
in the adrenal.
the management
So there
of
is
Cushing's
transsphenoidal
disease,
right?
adenoma-
If you have a
adenoctomy,
patient of Cushing's,
then there are two
confirmed
outcomes.
Cushing's disease.
Disease is cured,
Right?
and then there is a periodic
Remember,
follow-up.
disease means
persistent
that
or recurrent
is secondary.
disease.
Secondary means
Transsphenoidal
pituitary.
surgery.
Primary means in the
Persistent
adrenal.
or recurrent disease.
So there is
and
transsphenoidal
radiotherapy, adenoctomy.
Okay?
Right?
So
then
this
there
is
are
again
two
the pathway that we
disease
studied.
is cured,
And then there is a
need to
periodic
know exactly
follow-up.
everything, but just
Persistent
the
or
main
recurrent disease.
factors
Repeated
of the
transsphenoidal
adrenal
surgery,
and how are they produced,
persistent
and the
or recurrent
physiological
disease,
effects,
and
okay?
radiotherapy.
And just to summarize,
Okay?
management of
So
the
this is
Cushing's
again the
syndrome,
pathway
initial
that we
treatment will be
studied.
medical drugs
You
followed
don't
by
need to
surgery.
know exactly everything, but
Also,
just
they can be
the
used
main
some drugs,
factors
which stop
of
the
the
adrenal
pathway
synthesis,
synthesis
how are they
at different
produced,
levels. You
and
don't
the
need to know the
physiological
levels, but
effects.
just that they stop
Okay?
the enzymatic
And
reactions
just
of
to
the
summarize,
production
management of the
cortisol
Cushing's syndrome,
and
initial
different
treatment will be
corti-
medical drugs followed by surgery.
mineralocorticoids,
And at the
Also,
level,
they can be used some
there are
drugs
work at
which
different
stop
enzymatic
the
levels.
pathway synthesis at different
Also,
levels. You don't need to
if
know the
a
levels, but just
Cushing's
that stop
syndrome
the
persists,
enzymatic
there is
reactions of the
laparoscopic
production
or
of cortisol
retroperitoneoscopic
and
surgery,
different
which is
corti-
basically removal of the tumor of the
mineralocorticoids,
adrenal
and at the
gland.
level
And
there are work at
obviously,
different enzymatic levels.
it's produced
Okay?
in a way that
Also,
it leaves a very
if
extremely small
Cushing's
wound.
syndrome persists,
Okay,
there is
laparoscopic,
then guys,
or
this will be the end
retroperitonoscopic
of
surgery,
the lecture,
which is basically
there are
removal
few
of the tumor
questions
of the
right,
adrenal gland,
which you
and
I will do
obviously,
again like the other time.
It's produced
which
in
are
a way
questions
that
for
it
you
leaves a very
to assess
extremely
your
small
knowledge,
wound.
right?
We're not going
Okay?
to run over all
Then
of
guys,
them,
this will
but
be
I
the
will
end
be
of the lecture.
adding these
There are few
questions
to the
right,
presentation,
which
and then I'm
I
gonna
will
give
do
you the
again like the
answer
other time,
after,
which are questions for you
So some
to
of them
assess your
we
knowledge,
already
right?
went
We're not
through.
going to
Like for
run
example,
over
sex
all of
hormones
them,
are secreted
but
by
I will be
zona glomerulosa,
adding these
the gonads,
questions
zona
to the
reticularis,
presentation, zona
and then I'm gonna
fasciculata,
give you the
all
answer
endocrine glands,
after,
right?
Remember,
So
zona
some of them
reticulari
we
and
already
right
went
so,
through.
like for example,
basically,
sex hormones are
I
secreted
want
by
you to go through these
zona
questions again
glomerulosa,
to remember
the gonads,
all the
zona
HP
reticularis,
axis
zona
adrenal.
fasciculata,
Because now we're
all
going to do two more
endocrine glands,
diseases tomorrow.
right? Remember,
Aldosterone
zona
disease,
reticulari,
right?
and
What
gonads,
happens when there is
right?
too
So,
many or too much?
basically,
I want you to go through these questions
again,
but
to
also
remember
we will
all
study
the HP
the
axis
medulla, because now we're going to do two more
catecholamines
diseases
conditions.
But we will do
Aldosterone
that
disease,
tomorrow,
so
right?
I will put
What happens
these
when there is
questions to you
many
in the
or too
PDF,
much,
okay?
mineralocorticoids.
They will
But
not have the
also
answer,
we will
but I will
study
upload
the
the answers
medulla
into your
with
presentation
catecholamines
in
conditions.
QM+.
But we will
you
do
can
that
do this
tomorrow.
on
So
your own.
I will
okay?
put
these questions to
Thank you
in the PDF,
very much. And now
okay?
we have a
And
session, open
they
session.
will not have the answer,
If you have
but
some
I will
questions,
upload the answers
right,
into
where,
your
let me
presentation
stop here,
in QM+. So you can do this on your own, okay?
stop share.
Thank you
And
very
then
much.
if you have some more
And now we have
questions,
a session,
right, we will have
open
now
session,
one
if
hour
you have some
where
questions,
I will send you
right,
the password
where
and you
let
can
me
have
stop
questions if
here.
you need. Remember, tomorrow we carry on with the adrenal
Stop
pituitary
share.
axis,
And then if you
but
have
the
some more
conditions that
questions,
affect,
right, we
not
will
the
have now
hypersecretion, but the
hour
hyposecretion,
where I will send you the
aldosterone,
password,
and also
and you can have
the
questions if you
obviously
need. Remember,
medulla
tomorrow
with the
we carry
adrenaline
on
and
with
catecholamines.
the adrenal
Okay,
pituitary
thank you guys.
axis,
Bye.
but the conditions that affect not the hypersecretion but the hyposecretion, aldosterone, and also the obviously medulla with the adrenaline and catecholamines. Okay, thank you guys. Bye.